Hi, I'm Neha Pagidipati, and I'm a preventive cardiologist at Duke University and the Duke Clinical Research Institute. And I'm really excited to speak with you today about the CardioHealth Alliance and specifically about the Test to Treat program. The CardioHealth Alliance is really kind of a coalition of the willing to try and improve the implementation of effective and evidence-based cardiovascular therapies. And so really one of the first programs in implementation that we're putting through the CardioHealth Alliance is the Test to Treat program, and we're really excited about it. And basically the goal of the Test to Treat program is to improve LDL cholesterol checking and management in patients who have been admitted with a heart attack or the need for coronary revascularization or peripheral arterial disease, and kind of really guiding them through that inpatient to outpatient transition where unfortunately a lot of the time patients fall through the cracks and they get lost. So what we know is that patients who have had a cardiovascular event, like I just mentioned, they need to have their LDL cholesterol managed tightly and appropriately. And unfortunately, we know from data all over the country that that's just not happening. And so our goal in the Test to Treat program is to work with the CardioHealth Alliance to improve the management of LDL cholesterol in that critical inpatient to outpatient transition that patients are experiencing. And so in terms of the work with the CardioHealth Alliance, it's actually been critical because we've gotten feedback and input from the executive committee from all of these different and very diverse and heterogeneous health systems. And because really what we're trying to do is not just create a program that works for one health system or one patient. We're trying to create a program that can be implemented and disseminated across many health systems. And so in order to do that, you need something like an alliance, a platform like an alliance, to allow us to work with many different health systems that are engaged, have their scientific and clinical leadership engaged, and it will help us to understand how we can best implement this kind of program across many different health systems, because that's really how dissemination will happen in the long term. Another implementation program that we're really excited about within the CardioHealth Alliance is going to be focused on improving the screening and management of patients with chronic kidney disease. We know that across the country and really across the globe, chronic kidney disease is a huge problem that is under-recognized, underdiagnosed, and undertreated. And unfortunately, it primarily or disproportionately affects underserved and vulnerable populations. And so it absolutely is an area that we want to focus on within the CardioHealth Alliance, especially given our equity focus. We're actually really excited about this program because it's going to be one of the first that is in partnership with multiple life sciences programs. And I think that speaks to the collaborative and interdisciplinary nature of what we're trying to do within the CardioHealth Alliance. And what's really exciting is that we're not only going to be working with multiple health systems to understand how can we use their electronic health record data to identify patients who potentially have chronic kidney disease but just haven't been screened, and how do we do that in a way that alleviates participant burden and helps patients understand what chronic kidney disease is, but then how do we actually manage them? Because it's one thing to screen for disease, but then you obviously have to treat it as well. And so how do we manage them? What are the best ways to do that in ways that do not increasingly burden primary care providers who already have too much on their plates? And so we'll be testing multiple potential interventions to try and improve both the screening and the management of chronic kidney disease across many health systems to understand how it can then be disseminated more broadly in the long term.